The difficulty in veterinary practice is sometimes in accurately diagnosing and prescribing the appropriate treatment. Unlike in human medicine, whereby the patient is able to communicate his history and symptoms to the doctor, animals are unable to communicate their discomfort to us. Hence, being able to accurately diagnose and treat through any derived information is a very important skill. There are two ways by which an accurate diagnosis can be derived. The first thing to find out is the history of the patient. This includes the food taken, whether it is a balanced or unbalanced diet, the environment, which includes hygiene, the comfort of the animal, and whether any other animals are in the surroundings. Age, gender, species, and any other or ailments. Then, a full-bodied examination of the patient is done. Also, how active the patient is must also be noted. The treatment will then be dependent on the cause of the symptoms, and its success will be dependent on the severity of the problem. To illustrate these principles, let's look at 3 terrapins with swollen eyes.
It came on 26 January 2013 with the complaint from the owner that the right eye is swollen. Upon examination, both eyes are slightly swollen, with the right eye worse. However, we can still view the cornea and they appear to be clear. It is also observed that it is trying to scratch its eye. Other parts of the body look normal. From the clinical sign, we can probably tell that the animal is having conjunctivitis. Owner sent it here 2 weeks ago also with the same complaint. It had both swollen, puffy eyes and it can't be opened. Since both of the eyes are affected, the possible cause is not trauma. Rather, it is infectious in nature. It may also be having conjunctivitis. It was presented around 2 weeks ago with right swollen eye. However, it now has developed pneumonia. This can be diagnosed by observing that it was gasping for air and extending its neck while opening its mouth. This is clearly a sign of upper respiratory tract infection, complicated by eye infection. The prognosis of this animal is poor and it has lost appetite and was looking dull and inactive.
First of all, before we begin the treatments, we must first clean the tank and replace the water with fresh ones twice daily. Then, using a brush, lightly scrub all parts of the terrapin and rinse. Next, we proceed with sunbathing. The terrapins are sunbathed for 30 minutes with their tanks raised on one side to provide dry area for them to rest. Usually, feeding was done once daily and they are fed commercially available pellets. Always observe whether they are eating or not. Then, we proceed with the treatment with vitamin A, D, E, available as NutriPet in veterinary clinics or pet shops. The method of treatment is to administer a drop of the paste orally using a 1 ml syringe. This, however, may prove to be difficult as you can't force the terrapin's mouth to open. Vitamin A, D, E are fed orally because they are fat-soluble vitamin and will not dissolve in water. Next, we move on to the treatment of the eyes. Since the eyes are swollen and itchy, it may be infected with conjunctivitis, so we need to administer topical antibiotic eye drops. Give 1 drop on each eye twice daily and allow the eye drop to sit in for 2 minutes before putting the terrapin back into its tank. This treatment regime will be performed daily until the disease recovers.